COVID cases in the second wave in India, and the usage of steroids, prolonged stay in hospital and ICU and on oxygen therapy for a long duration, some of these COVID-19 patients are getting infected with a rare but serious fungal infection known as mucormycosis, commonly known as black fungus. In the past few weeks, thousands of black fungus cases have been reported across the country. Many states have declared it as an epidemic, and the government of India has made it as a notifiable disease. Mucormycosis is caused by exposure to muc or mold, which is commonly found in soil, plants, and decaying fruits, manures, and decaying vegetables. It affects the sinuses, the brain, the lungs, and can be life-threatening in diabetic or severely immunocompromised patients, such as cancer patients or people with HIV and AIDS. Steroids are the main line of treatment of COVID-19. They act by reducing inflammation in the lung, but they also lead to reduction in the body immunity and can raise the blood sugar levels in both diabetics and non-diabetic COVID-19 patients. Since the drop in body immunity, this could trigger the cases of mucormycosis. Black fungus commonly affects the sinuses or lungs after a person inhales the fungal spores in the air. It can also affect the skin following a surface injury like a cut or burn. Symptoms depend on where in the body the fungus is growing, but can include facial swelling, fever, skin ulcers, and black lesions in the mouth. The disease begins to manifest as infection in the air pockets located behind the forehead, nose, cheekbones, and in between the eyes and the teeth. It then spreads to eyes, lungs, and the brain. What are the various signs which are issued by ICMR? Sinusitis, there is nasal blockage, congestion, nasal discharge, which can be blackish nasal discharge or bloody nasal discharge, local pain on the cheekbones, maybe one-sided facial pain, maybe numbness, maybe swelling. There is a blackish discoloration over the bridge of the nose or the palate, that's the upper part of the mouth, loosening of the teeth, and there may jaw involvement, blurred vision or double vision with pain, thrombosis or necrosis of the skin lesions, chest pain, collection of fluid in the lung, or worsening of the respiratory symptoms. Patient becomes more breathless. The black fungus reduces the circulation to the distal organs and hence produces what is called as necrosis or the death of the tissue, which then becomes black. That is the reason is given the name black fungus. COVID-19 patients are particularly susceptible not only because the virus affects the immune system, the treatment drug also can suppress the immune system. COVID patients undergoing oxygen therapy in ICUs may have humidifiers in the ward, which can raise the exposure to moisture and make them more prone to fungal infection. But it doesn't mean that every COVID patient will get the disease called a mucormycosis or the black fungus. What are the ways one can reduce the black fungus? First, the oxygen which is administered in the ward at very high flow requires humidification. This is done by passing it through a container filled with sterile water. The water itself must be sterilized and changed frequently as per the protocol. If the water is not sterile, it is potentially a source of black fungus infection, especially if high flow oxygen is given for a prolonged period of time in the hospital. On the other hand, if the oxygen is given without humidification, it will dry the mucous membrane and damage the inner linings of the lung. It will also make the sputum or secretion very thick to clear out, and these have created havoc among patients. Secondly, the use of steroids. Steroids have been being used left and right in treatment of COVID-19 patients. They are the mainstay of drugs for the treatment of COVID. It is very harmful and very dangerous if used in the first 5 days of the treatment when the infection sets in. This is the time the virus is replicating. This is not only reduces body immunity, but also giving steroids unnecessary at this stage for both diabetic and non-diabetic patients can worsen the sugar levels and disposing this patient to ill effects of black fungus. So a clean, proper oxygen delivery system and avoiding indiscriminate use of steroids will definitely reduce the incidence of black fungus in COVID patients. Black fungus is treated with antifungal medicines, often given intravenously. The most common medicine used is amphotericin B. Patient may need up to 6 weeks of antifungal medicines to recover. Their recovery depends on how early the disease is diagnosed and treated. Often surgery is required to cut away the dead or infected tissue.